Thank you for joining us, Dr. Gensini. Dr. Gensini will talk to the group in regards to most recent vaccination efforts on behalf of PMS and other statewide medical institutions throughout the state. I would ask this, that if everyone can put their phones or their microphones on mute so there's no bleed over in the background. If you have questions, please feel free to ask. If you would like to ask those questions through the chat feature, please feel free to do so as well. We'll save a few minutes at the end of the presentation to review questions, any questions that may be asked. Again, like Caroline mentioned and like we were discussing prior to this, the actual presentation will be recorded. Today's meeting will be recorded, and we'll post this on the website as well. And so having said that, the man of the hour, Dr. Gensini, thank you for joining.
No, thank you, everybody. Thank you for having me. It's been quite a while since I've met with you guys. At that time, it was, early stages of COVID-19 back in March of 2020. So now I come, I guess, with a more enlightening message about COVID-19 vaccines and the strategic approach from the Department of Health and how many, FQHCs and healthcare systems across New Mexico are starting to vaccinate, in a phased approach, and we'll go over that. Many of you might have questions of when can you get your COVID vaccine. So I'm going to jump real quick into the presentation I created. So give me just 1 minute. I'll start sharing my screen. Okay, and I hope you all can see that. So today we're going to talk about what you need to know about COVID-19 vaccine. I created kind of a frequently asked question format of the presentation and kind of the things you most likely want to know about this type of vaccine. We're going to go a little bit over how the New Mexico Department of Health has a strategic approach to vaccination through a phased approach on the state. And how do you need to get registered in the COVID-19 vaccine application from the state in order to receive your COVID-19 vaccine? So one of the main things, as you all know, currently in the United States, we have 2 vaccines that have been approved under an emergency use authorization. This is something that it's, in my lifetime, it's been the first time as this pandemic has been unique to us. There are currently multiple vaccines that are being created or made at this time, but Moderna and Pfizer vaccine have been approved under the Emergency Use Authorization Act back in December-ish of 2020. So we currently have 2 tools to fight against COVID-19. What the Emergency Use Authorization is basically we currently do not have a Food and Drug Administration or an FDA-approved treatment for COVID-19. We have some medications and some therapies that we can utilize to combat the symptoms that COVID-19 creates and hopefully help our patients to not feel the sequelae of COVID-19 or reduce the hospital stay and have them improve at a faster pace. But there's not a FDA-approved treatment for COVID-19. What these vaccines are, the current Pfizer and Moderna vaccines, are called mRNA vaccines. And if you've seen the news, there's a lot of, misinformation, unfortunately, about that this could alter your DNA and go into your body and chemically change how your DNA works and stuff like that. So I'll try to put it as least medical terms as I can, but the mRNA is a fatty particle, if you can see in the middle of the screen, and it has this lipid layer around it. So what this does is basically helps that particle get into your cells. It cannot enter the nucleus of your cell, which is where your DNA is. So it basically goes inside the cytoplasm of a cell, which is the outer aspect of your cells. And it basically helps the cells of your body identify an abnormal particle in your system and create antibodies against it. So what we're doing with this type of vaccine, it's called the mRNA vaccine, which is there was the spike proteins. So COVID-19 has kind of a spike appearance, and these spike proteins are the ones that attach to your cells and enter the cells and cause disease. So what we're doing with this type of vaccine is we're replicating a little bit the mechanism of how the virus gets into your vaccine, but there's no virus in it. And we're allowing the body to identify this spike protein and make antibodies against it. So whenever you come in contact with COVID-19, your body will react immediately to it and fight it again, and fight and create, the immune response that you want. So what are the benefits of getting your COVID-19 vaccine? Well, COVID-19 can cause severe medical complications and lead to death in some people, especially people that have chronic medical conditions, diabetes, high blood pressure, even obesity can cause significant risk of complications of COVID-19. Unfortunately, there's no way that we know how COVID-19 can affect each of you. Some patients only lost their taste or smell, and that was it. Some of them never had any type of symptoms at all, and they never knew that they had COVID-19. Some develop very fast symptoms that end up in the hospital, ICU. They end up intubated, and they have far more complications than some people. Up to 24% of patients within New Mexico have been healthy with no chronic medical conditions that they've had. So this also affects healthy people. Now, out of those healthy people that had COVID-19, 17 ended up in the intensive care unit. So we still need to learn a little bit more about COVID-19 and how it can affect people that don't have any underlying condition. So at the beginning of the pandemic, when we were talking about early stages, we always focus on elderly patients, nursing homes. They had a lot of that. And then that quickly shifted to the patient panel that has the most COVID-19 are early or younger adults between the ages of 20 and 40. That's where kind of the most sit at this point. Now, the problem that we have is you could spread the disease to family, friends, and others around you. Sometimes if you don't have any symptoms, you will still spread the virus until, a grandma, grandpa can contract it, and then they develop those symptoms. So getting a COVID vaccine can help protect you by creating that immune response, those antibodies within your body without you having to become sick with COVID-19. Now, if you get COVID-19, it can actually help you from preventing serious illness. One thing we need to understand is this vaccine, when we say it creates 95% immunity against COVID-19, it doesn't mean that you cannot contract COVID-19. If you get your vaccine, your body creates antibodies. And if you come in contact with COVID-19, your body immediately fights it. It doesn't have a delay response where the body has to create the antibodies, act against the virus, and then you start recovering. This is more an instant attack on the virus. So your symptoms might not be there, but nonetheless, you can still get contaminated or infected with COVID-19. I think this is a million-dollar question. Can I get COVID-19 if I get the COVID-19 vaccine? The answer is no. You cannot get COVID-19 from the vaccine. However, like the flu shot, we give the flu shot in the flu season. So most likely you could become in contact with the flu before you get your shot. Many people say, well, I got the shot and I got sick. You could have been in contact with somebody the preceding 14 days that led to you getting flu, and then you got your shot, and then you can make that correlation with that timeline. However, you have to keep in mind that when we give you the vaccine, and this is a 2-dose series, separated 21 days from Pfizer and 28 days from Moderna, the body needs to create those antibodies, and the response needs to be mounted first. So it can take up to a few weeks after you build your immune system, after you get your vaccine, and as a result, if you become in contact with somebody that has COVID-19, you can still get infected with COVID-19. So that's why we always keep saying you have to wear your mask, social distance, wash your hands. All of the same practices need to be still there, because not because you get your COVID-19 shot means that those precautions need to go away. So it will take time for your body to create the antibody response. generally after your second shot, which is 21 days for Pfizer, 28 days for Moderna, 7 days past your second shot or completion of your series, your body now will have a 95% response against COVID-19. So we have to keep that in mind. You have to have the 2 shots to be able to get the proper immune response we're trying to target with those vaccines. What are the possible side effects of the COVID-19 vaccine? I'll tell you my experience as a frontline healthcare worker, seeing patients. I got my vaccine. I am due for my second shot this Thursday. My shot, I got the Moderna vaccine. The only thing I experienced was pain on my arm. If you've got the Tdap, if you've got the MMR, if you've got the shingles shot, very similar to that. And your arm is heavy, your arm is painful, you can't sleep on that arm because it bothers you. That's the only thing I had. Now, that lasted for 2 days. I got my shot on a Thursday, and Saturday I was good to go. After that, I have not experienced any type of symptoms or anything at all since then. But you could still develop pain, redness on the injection site. Some have developed fever, headaches, fatigue, muscle pains, chills, and joint pain. Now, these are good things to have. If you have a headache, muscle pains, joint pain after your vaccine, it means that the vaccine is working, that your body is reacting against the particles, the mRNA. It's identifying an abnormal substance in your body, and it's creating antibodies against it. So that is a good thing, meaning that the vaccine is helping you. The vaccine is causing the creation of antibodies, which is good. Now, you probably have heard reports about, serious adverse events. People have had anaphylactic reactions. Physicians in Alaska had to be, epinephrine, and one of them was in the ICU. As any other medications we utilize in the healthcare system, like any other vaccine, some people might be allergic to the components of the vaccine. In that case that you've had this type of reactions in the past, you should contact your primary care physician prior to receiving your COVID-19 shot to have clearance from them. However, because of this newer type of vaccine that we're seeing, or a vaccine that has gone through the entire process of verification, but at a speed that has not been seen before, some people might have apprehension about that. But nonetheless, you will be monitored post-vaccination between 10 and 30 minutes to ensure there's no immediate reactions to the vaccine. Now, most side effects happen, or more of the symptoms related to the vaccine happen again within the first 3 days, and they resolve within 1 or 2. I didn't feel the shot at all. My pain started like 6 hours after my shot. And again, like I said, it lasted a couple of days. So can you get the COVID-19 vaccine if you have a severe history of allergic reactions? And this is not just only to injections or vaccines in the past or any type of, injectable medications. This is also if you've had bee sting allergies, nut allergies, food allergies, something that has caused a severe reaction to you that you've gone into an anaphylactic shock. What that means basically is your body swells up completely, your throat can close, you will need to have medications to intervene so you can actually, or end up including in the intensive care unit. If you've had those type of allergic reactions, including to bee stings, or you're those patients that have EpiPens with you because, you've had those type of allergic reactions in the past, the guidelines that we currently have from the CDC, Moderna, and Pfizer say you can get the vaccine, but you have to be monitored for 30 minutes. The only contraindication to getting the COVID-19 vaccine is if you've had a history of anaphylactic reactions to vaccines overall, or to any injectable medications. Now, you might be allergic to a component of the vaccine. One of the most common ones is the polyethylene glycol, which is kind of a substance that we utilize for vaccines. And if you're allergic to PEG, right, you should not get this type of vaccine. So again, if you have this history of severe allergic reactions, consult with your primary care physician prior to receiving it. just as a caveat, in all our PMS sites, if we administer the COVID-19 vaccine, we are ready to care for any type of allergic reaction. We have our EpiPens. We have everything ready to be able to counteract an allergic reaction. Can pregnant and breastfeeding women get the COVID-19 vaccine? So this is a question that more and more we're starting to see. You probably have seen in social media or the news, more and more phase 1A frontline healthcare workers, that are, breastfeeding or pregnant, they are getting vaccinated. And currently, there's not enough data or research to know if this is safe during pregnancy or breastfeeding women. However, in the logic of how your body is acting against creation of antibodies and how you are potentially transferring those to your baby, currently a lot of moms, expectant mothers and moms breastfeeding are getting their COVID-19 shot, and we haven't seen any type of adverse reaction with that. However, if you're pregnant or breastfeeding and you're part of a group that is recommended to get your COVID shot, please talk to your healthcare clinician about the risks and benefits of getting your COVID shot. Should you get COVID-19 vaccine if you've already had COVID? The answer is yes. You should receive your COVID-19 vaccine even if you've had COVID-19 infection in the past. So getting your COVID-19 might offer getting COVID-19 infection offers you a natural type of immunity. This is that immunity that I was talking about when is the same type of principle. Your virus gets attacked into your system starts to create antibodies. Antibodies take between 2 to 3 weeks to create. And now it's why, those severe illnesses, but you don't have a defense mechanism ready to act when you have or become in contact with COVID-19. So there's some type of natural protection. Unfortunately, it is not clear how long that protection can last or how long those antibodies are going to be present in your body. Historically, now with the information we have, we're seeing a good immune response within the first 90 days. After the first 90 days, then your immunity or natural immunity, it starts to decline. So what we're seeing with the vaccines is because you're getting a vaccine on day 1 and then re-getting another vaccine on day 28, your immune response is being boosted up at the second time. And those boost up kind of antibodies that you're creating now, according to the recent data that happened this past Friday, Moderna vaccine says that the immune response from the vaccine can last up to a year. So that's good news. Unfortunately, that also tells us that most likely we're going to have a COVID-19 vaccine shot every year. So it's something that hopefully can last longer. There's multiple other type of vaccines being created that could protect longer. So again, it's something that we just expect. Now, however, as the vaccine rolls out and we have widespread availability of the vaccine, we're saying right now, because there's limited vaccine, is if you've had COVID-19, don't get your shot now. Wait for 90 days and then get your shot, because at least you're now some natural immunity is protecting you against COVID-19. Once it is widespread available vaccine, you don't have to wait the 90 days. You will have to wait only the quarantine period to get your vaccine. But currently, because no widespread availability of vaccine around us, we are prioritizing those that don't have an immunity or natural immunity from a COVID-19 infection. So we're vaccinating those that are non-immune first and allowing those that have had COVID to be on a second round. But if we had vaccine for everybody at this point, everybody could get vaccinated post their quarantine period. So can you stop taking precautions after getting a COVID-19 vaccine? The answer is no. For the reason I talked before, this is not going to protect you against COVID-19 in the sense of you can never get it. This will actually help you if you become in contact, fight it from the first day and not wait 2 to 3 weeks for your body to create an immune response. So the symptoms could not be present. So what we're seeing is once you get the COVID-19 vaccine, you can develop an asymptomatic response to COVID-19. So basically you don't have any symptoms. Now, one of the things that we're studying right now are the scientists and all of the physicians across the nation that are studying COVID-19. when we give you the shot, what we're trying to understand is if you become in contact with COVID-19, you don't have symptoms, can you transmit COVID-19 to others? And that's the question that we don't know yet. So they're studying people that have received the vaccine, and they're going to follow them and see if they do become in contact with COVID-19 and get COVID-19. Is the viral load, what we call the viral load, enough to infect others? If the answer is yes, well, we have to continue wearing a mask, social distance, wash your hands, and stay home if you're sick. If the answer is no, then we're really seeing the light at the end of the tunnel to carve out COVID-19. Because if you get a vaccine and the creation of your immune response is so big that your virus, the capacity of the viral load is significantly low, you could not transmit COVID-19 to others. And that is a key thing. So we don't know yet. So once we see more, as you all know, people started getting vaccinated back on the second week of December. So we're still having the second wave of boosters happening last week and this week. So really, we're starting to see just now a bigger population of people getting vaccinated. And hopefully that'll give us enough information to determine if these vaccines help decrease the viral load significantly that we cannot transmit it to others. But until now, we don't know. So that is why we need to continue wearing your mask, wash your hands, social distance, and stay home if you're sick. So within the state of New Mexico, there is a strategic approach to the vaccine efforts. So there are currently 4 phases. Phase 1A, which started back on the end of December when we received our first allotments of Moderna vaccine, was all the hospital personnel. Well, second week of December, Pfizer got to the hospital staff. So hospital personnel, residents and staff of long-term care facilities, medical first responders, and congregate setting workers, people who work in homeless shelters, correctional facilities, residential treatment centers, and community homes. We also had persons providing direct medical care and others in-person services and home-based healthcare workers and hospice workers. So phase 1A was the first phase rolled out to ensure that frontline healthcare people started getting vaccinated. So as of last week, the state has moved on into phase 1B. Now, that doesn't mean that 1A is complete. We're still vaccinating some of the 1A folks that, for whatever reason, they were hesitant to get the vaccine, or they're in a very rural setting and we're trying to get them vaccinated. And right now we're still working on phase 1A, but we have moved into phase 1B. And that is great news. Phase 1B basically focuses on those that have more potential of death and serious complications. So it's people that are above 75 years old. Moving on to a sub-phase or subgroup of that phase is 16 and older that are at risk of complications or have at least one chronic medical condition as defined by the New Mexico state. Frontline essential workers that were unable to work remotely. And then we have, of course, our teachers, early education, K-12, educators, staff, caregivers, grocery stores, food and agriculture, public transit, critical manufacturing, people from the public health, public safety, mortuaries, indigent care, non-hospital laboratories. So now we really open up a more broader aspect of patients that could get their COVID-19 vaccine shot. Now, we're still dependent on the amount of vaccine we receive through the state. We're currently receiving enough to practice, the goal of the New Mexico Department of Health is 50,000 doses a week. So we're working towards that, and that's across the entire state, across all health centers across the state, 50,000 doses of COVID-19 vaccine per week. And that'll carry us over to the summer to vaccinate every New Mexican. So vulnerable populations, of course, residents of congregate settings in phase 1B, and then moving on for phase 1C in the springtime, to those adults 60 plus, other essential workers unable to work remotely. And at the end, starting summer, phase 2, which is everybody basically can get their COVID shot as long as they are 16 years of age and older. These 2 vaccines are not approved for 15 and younger. We currently don't have any studies on children getting vaccinated with COVID-19 vaccine at this point. So we've known historically from COVID-19 that they have less symptoms from COVID-19, but nonetheless, people are working towards providing an immune vaccine to children as well. So within this phased approach that we have, things can change, and things sometimes can change fast. Lately, we've been hearing news that once the new administration happens on tomorrow, that things might change. They might bring more vaccine to the States. They might bring more stuff. They might change the phase 1B age from 75 plus to 65 plus. So this is a fluid situation. As long as we have vaccine, we will be able to vaccinate our communities. As long as we have that supply chain demand kind of set up in a process that we ensure that we will have enough vaccine to not only give primary doses, but also your booster dose, because remember, this is a 2-dose series for any of the vaccines, then we will have to make sure that, that happens first. So things can change this week. Next week, the spaces might be different. So this is something that it's fluid. So make sure you're checking the website from the New Mexico Department of Health regularly, so you can see in what phase you're going to be falling. Now, what's the best way to kind of put yourself on the line to get your COVID-19 shot is actually registering in the New Mexico registration system. If you see here, NMDOH vaccine efforts are, if you go to their cvvaccine.nmhealth.org, you'll go into the registration page where they will gather all the information. What is your job? What is, your age, everything, your chronic medical conditions, all of that. And they will actually prioritize you in one of those phases. And then they'll tell you, your vaccine date is February 10th here in, PMS Rio Rancho or PMS Family or wherever it is. There are multiple FQHCs across the state that have this. The state, UNM does mass vaccination efforts as well. So I encourage you all to go and register within the app, putting all the information that you have, including what type of work you do, will help you be prioritized in one of those phases. And this is kind of an honor system. We basically say, depending on what you do, what you're working on, how you're doing, if you're remote versus face-to-face, that'll help prioritize where you will fall in. You might be asked to provide proof of your work. You might be asked proof of your credentials. If you're in the healthcare system, you have to prove, you're a doctor to get it and where you work and all of that. Sometimes the application will ask you if you have a chronic medical condition and you're getting it somewhere that it's not your regular care office, to bring a statement from your physician or bring a letter from the practice that you are a patient from, saying, yes, verifying that you have a medical chronic condition so you can get your COVID-19 shot. So that is part of my presentation, and I'll open it up for questions and see if you guys have any questions about COVID-19 vaccine, any concerns, or anything that I could respond to you guys.
Very good. Thank you, Dr. Gensini. So I have one to start. How important is that booster dose, the second booster dose? How important is that?
It is extremely important. So the way that these vaccines were created, look at it this way. Sometimes we've all received our MMR vaccines and our varicella vaccines, which are, kind of that viral vaccines. The first vaccine helps the body identify the particles, that spike protein, and your body now creates an antibody response to it. So that's the first step, making sure your body memorizes, creates antibodies to this type of special spike protein. The second dose is telling the body that you are getting contaminated with that same particle that the body already recognizes. So now that second immune response, it's extreme. That second immune response is actually like if you were getting sick. So what the body does is the body reacts completely and starts creating more memory and creating more antibodies during that second shot. So that one is extremely important. Without the second shot, your level of protection will be unknown. Now, if you complete your series, Moderna or Pfizer, they're 94.5% and 95% immune response once you get the series complete. So by the second shot, it's basically a critical shot to make sure that your body now is able to recognize the first kind of shot and now create or mount a big immune response. So that's why the second shot generally has more symptoms created to it. You can have more symptoms, headaches, fever, slight fever, joint pain, muscle aches. So the second shot can cause more symptoms related to the vaccine than the first shot. Many of you probably, if you've had allergies, if you got a bee sting one time and you're like, man, that really hurt. And then you get a second shot, then you're like, oh my God, like your body just goes into an anaphylactic reaction. And that's kind of a similar approach. You're trying to create or replicate a big immune response with that second shot. So once you complete those second shots, 7 days post that, your body is 95% protected in the sense of fighting against COVID-19.
Very good questions. I have another one. So obviously, when the vaccination first rolled out, there seems to be some concern with taking it, and people are some of the things that I'm hearing is, hey, let's just wait and see what happens type of approach, right? It's a delayed approach to see, if the folks who are in phase 1A to see how their bodies react to it. What do you have to say to the group that can kind of help them understand that the vaccination is safe?
Sure. I think my best approach was lead by example, right? That was kind of my motto. You've seen, it was interesting because everybody will tell me and approach me, it's like, why are they vaccinating all the doctors in the nation and stuff? It's like, we're going to, what if something happens? What if people start, dying from this vaccine and we're run out of doctors in the system? A lot of the apprehension might be from how fast this vaccine was developed. So we have to kind of recognize, was it fast in the sense of skipping steps, or was it fast because they had the resources and the money to do it and all of the power in the sense of, staff and hours that they could develop it? So they didn't skip any steps. They actually had the funding, they had the money, they had everything behind them to ensure that they could get through this process faster. Now, there were new technologies developed, actually. So that's a big plus, too. I mean, this has changed the healthcare system in the sense of vaccine creations forever. There were new technologies utilized, something that has, evolved from the last time we developed a vaccine. You guys have to realize that in the last, at least from my perspective, it's I've never been in a place where they developed a new vaccine in this speed. But nonetheless, it was something that 10, 20 years ago might not have happened. But now with the technology that it is available and the resources they had, they were able to speed up the process, but not skip any steps, which is good. I mean, I've read all the phase trials that they did, and it was very promising. There's no safety. You've seen everybody from leadership, Dr. Fauci got their vaccine. Everybody's getting their vaccine in that sense. So I think as physicians, as doctors, we are putting ourselves not as guinea pigs, but we're trusting the science. We're trusting the process. We're trusting the phases. And we're telling basically our patients is, I do trust it, and that's why I got it. Because this is my best shot to fight COVID-19. By far, the complications of COVID-19, and believe me, I've seen patients that are on oxygen now. They have not been able to recover. They can't, walk 100 feet without having to stop to rest. And these were young people, in their mid-40s, 50s, and they were good. They were not having any issues, and now they're, carrying a tank of oxygen with them, and their life has significantly changed. So I've seen what COVID-19 can do. And like, I did it for my family. I did it for my kids. I want to make sure I have the best shot to, if I get COVID-19, as in my job line, you are very in contact with that. So I want to get the best shot. And this is our best shot to go back to normal. This is our shot to get back to, a bar, the movies. I miss the popcorn on the movies. It's kind of that part. I miss going out to dinner. The simple things that sometimes we, realize now. It's, I would just want to have time and spend, a good meal in a restaurant and be able to go out without, masks and all of this stuff. And I think this is the best shot we have to go back to what we call the new normal life. But it's going to take time. We're not out of the woods yet. And the more people get vaccinated, the better it will be. And I know it's an anxiety piece, having an emergency use authorization, telling basically you as a patient, or, if you're in the healthcare system, the same is we need you to trust us that this vaccine is going to help you. That's a big ask. So I always tell my patients this: here's all the education, here's all the information you need to know. I can tell you my experience from when I received my vaccine and how I am feeling, but that could be a different experience for you too. But I want to make sure you have all the information to be able to say, yes, I want it, or if you don't, that's fine as well. But you need to continue to do all of these precautions as well. And I'll talk to you the next time I see you again, and I'll try to educate you more about COVID-19 vaccine and how this is going to help us, have that shot at going back to a new normal life.
Thank you, Dr. G.
I have a question. So I know you don't have a crystal ball, Dr. Gensini, but I know that, we sort of outran the Spanish flu back at the beginning of the 1900s. What concerns me is I remember hearing they said 240,000 people would die. Now we're pushing up on 400,000. I mean, do you see, here again, I know you can't predict this accurately, but, people getting vaccinated, the herd immunity aspect of it, what do you think, 2 years? I mean, I'm just asking for...
Yeah, I think, historically to achieve herd immunity, it takes years to do that. It's not just something that happens, within a couple months. So it will take time. But like I said, if the vaccine research and data tells us that if you are vaccinated and you will not transmit the virus, that would be a big leap. But if we basically say, and this is what we know now, coronavirus is going to be here forever. This is going to be a seasonal type of condition as well. So getting vaccinated every year is going to be probably what we will have to do to be able to, stop wearing our masks and all of that stuff. But achieving herd immunity can last, 1 to 2 years to achieve, if not more. Now, with this type of vaccine, the way that it was developed, now that we have it within, 10, 11 months, that can give us a little bit of a leap into being less time frame. But it's difficult to determine if the vaccine becomes more and more available to everybody. It could be the best time, the best shot that we have to curbside it as much as we can.
Thank you.
Okay. Further, go ahead, Chris. You're on mute. You're muted.
Yes, Doctor. I just got a quick question. In your opinion, what is the best treatment out there right now if you do have COVID?
So currently, right now, there's 3 that they are utilizing in the state of New Mexico. One is the remdesivir, which actually decreases your length of stay by 4 days. It doesn't change too much the mortality, but it definitely helps with kind of the symptoms and avoiding kind of the use of oxygen. Regeneron, which only 2 hospitals here in the state do it. I haven't read too much about that, but there's a new one that is the monoclonal antibody that we're starting to utilize more and more, and that's for mild to moderate COVID-19, which is an outpatient treatment. So we're trying to avoid you going into the hospital and having far more complications. So the monoclonal antibody right now, it's starting to be more available through the state. And your regular doctor, if you have COVID, they can order it and you can just get infusions of it and then, avoid the complications. I don't think there's a best treatment. I think we have alternatives. We have resources that can help.
I need to bring your charger.
Decrease the complications.
I know.
Great. Thank you, Doc.
Okay, are there further questions?
I have a question.
Go ahead.
This is Aaron with Roof Care. My question is, I know you talked about people having allergic reactions to the vaccine, but what about people with pre-existing conditions? I mean, do you recommend people, we'll use me for example, I have asthma and pre-hypertension. Would you still recommend that I get a vaccine?
Absolutely. Yeah. So basically what we're looking at, if you have pre-existing conditions, they can actually put you at risk of further complications of COVID-19. So people that have, like yourself, asthma, that affects the lung system, COVID-19 can damage significantly the lungs. So what we're looking at is basically people that have pre-existing conditions that can predispose them for higher risk of COVID-19, they should get vaccinated.
Okay, very good.
That was a great question.
I have a quick question. I had to step away a couple times, so if I missed this, I apologize. But you always hear about the respiratory issues that COVID brings. I just want to have your thoughts on I think it's weird how COVID makes you lose your sense of smell and taste, and it kind of seems like totally separate from the lung issue. Could you touch on that a little bit?
Sure. So COVID-19 creates a lot of inflammation in your body. And that goes as well for your kind of just, let's say, sense of taste and smell. We currently don't know a good mechanism of how it does that. But what we do know is that there's significant inflammation across your entire body that can be altering your senses, the nerves, the lungs, the heart, all of that. But there's not a well-known mechanism of how and why COVID-19 is causing loss of taste or smell, which is very interesting because at the beginning, very few people started reporting that. And now it's like, if you have loss of taste and smell, you have COVID-19. I mean, it's something that has become now kind of what we call pathognomonic of COVID is if you lose your sense of taste and smell, you most likely have COVID-19. And that is one of the things that we're seeing more on healthy people that don't have underlying conditions, that's the first thing that they will lose. And sometimes we still have patients that are 3, 4, 5 months out and they still have not recovered their sense of taste and smell. So it is interesting. I don't know exactly the mechanism of how COVID-19 does that. What we do know it's because of the severe inflammation it causes in your body. That's why a lot of the things you've seen, the complications are clots and, the lungs get like completely wiped out and all of that stuff. It's not because there's an infection overall, but the virus is causing a severe inflammation of your system. But that's a great question. And I wish I knew exactly how it does it, but I could get published if I do that, which will be great.
One more quick question. I know that there's not a whole lot of research out here on the vaccine. Is there any indications that it could lead to kind of behind the scene issues like unable to have babies, infertility, and other things like that maybe you wouldn't think of that aren't directly related?
Yeah, so currently we don't know because of there's no data. There's not enough data to actually determine what any long-term complications, if any, the vaccine can cause. There are some, information out there that it could cause infertility or sterility and all of that, but we don't know that. There's no data that can show us that yet. What we've, in the past, they've said that in children, COVID-19 was doing, again, by means of inflammation, causing, in boys, testicular inflammation that could lead into infertility. So again, that's, something that we don't know yet. The more and more people get vaccinated, of course, like any type of treatment or vaccines or medications we put out there, some other adverse events can happen. And once, hopefully it doesn't. So far, it hasn't had any kind of replication of all of that. So it's too early to just say at this point.
Thank you.
Further questions? Okay, well, it's 9:16. I would like to return at least 14 or 13 minutes of your day back to you. I would like to give a special thanks to Dr. Gensini for joining our meeting and providing us with some much needed enlightened information. Thank you, Dr. G, for providing that. I can share my story really quickly here. I had my shot last week, and I feel great. And so I'm glad that I took it. And I think Dr. G is correct. It's the quickest way for us to get back to normal, right? Whatever that is. And so I encourage everyone to take the shot. And so, but having said that, I want you guys to also be safe. And so we live in a time now where we need to really look at that and be aware. And so, Dr. G, thank you. Can't say it enough. Thank you for joining and providing this information. Please feel free, if you have questions about the information and content that was shared, to email myself directly, and I'll get them to Dr. G, and we can follow up with an answer. As stated before, Roy will post this on our website. And if you have further questions, or you just wanting to seek additional information, I encourage you to visit the New Mexico Department of Health, their website. They may have some questions on there that can be answered for you as well. Thank you for joining, and be looking out for our February meeting. We appreciate it. Thank you so much, guys.
Thank you.
Everybody. Be safe. Have a good day.
Thank you.
Thank you, Dr.